welcome back to, once again, another school video project. Now, this one was fun for me. I learned a lot. Yeah, there were actually a couple of things that I learned that I was kind of not expecting. Once again, just kind of a quick disclaimer. Um, my teacher's name will not be on here for privacy reasons. So if there are any cuts, it's probably for that reason. Okay, let's get right into it. So let's start with a little explanation on the project here. The project was about the body systems, and we needed to find one organ of each of the body systems: digestive, muscular, excretory, circulatory, and respiratory, and explain what they do, how they do it, and how things can go wrong, and how to fix it when it goes wrong. So let's start with the liver, probably the most complicated of everything I decided to do. I had to choose the liver. And not only that, I had to not read the project information before starting this project and do everything about the liver in all the different systems instead of just the digestive system. Because I'm a dumb bottom. Right. So the functions of the liver. First of all, it produces a compound known as bile to break down fat. Bile, all bile is it's like a salt that kind of surrounds fat globules, which are, if you ever seen a droplet of water on a wax piece of paper, it's very similar in style to that. And what it does, it emulsifies the fat particles and breaks them up into smaller chunks for other enzymes like lipase to break them down more efficiently. That's how it helps the digestive system. Now, it does a lot of things. Like, the liver is arguably the most important organ in your body, other than the heart and brain, by far. You can probably get away without your pancreas producing the carbonate to neutralize the acid in your stomach. But without the liver, every single one of your other systems breaks down substantially. So one of the other things it does is it detoxifies the blood by removing harmful substances like drugs. This would be your prescription drugs, your heroin, your marijuana, your anything bad you decide to do. Don't do drugs, kids. And really what it does is it just really collects it, which is part of the reason why liver cancer is a little bit more common, is because all those toxins built up in the liver eventually damage the cells enough that cancer happens. The other thing it breaks down is it breaks down alcohol, and it's less removal of the alcohol. It's more removing of the ethanol in the alcohol. And again, it really just kind of stores it. It does get rid of it through urine and that, but that has more to do with the kidneys rather than the actual liver. The liver just kind of is a storehouse for a lot of different things and a production center of a lot of different things. The liver then ships these harmful substances, which are classified as drugs and alcohol, when in actuality they are specific compounds inside, and then ships them to the liver to be dealt with. The liver regulates blood pressure or blood levels by creating proteins that maintain blood volume and osmotic pressures, which osmotic pressure is really just if through a membrane, if this side here is your blood and this side here is your stomach, or not your stomach, your intestines, for example. What it does is this side's highly concentrated with stuff. Um, Technically, it's chyme, but since I'm not talking about the stomach, I'm not going to get too far into chyme. But basically, what chyme is a emulsification of stuff mixed with, well, I suppose it would be mixed with water and salt because at that point, the hydrochloric acid would be neutralized. On this side, however, there's blood, water, and a lot of stuff. Um, well, I suppose at the intestines there would be a little less stuff, but there is still a lot of stuff in blood. So what it does is it creates proteins that kind of prohibit um, water from leaking into uh, the small and large intestines, so that it can suck stuff out. And that protein, the major one, is called. I'm not even sure how I'm going to say that. Albunium. Albunium. I don't know. Something that starts with an A. Um, it has a large molecular size and a negative charge. Now, what this means is that it's an ion with a negative charge, which means anything with a positive charge, sodium being the primary example, will be attracted to it rather than away from it. Therefore, pushing more salts into the blood, which creates a higher concentration in the blood of solute compared to solvent, salts compared to water, which then drags water from the intestine into the blood. This also prevents fluids from leaking into tissues. Similar to here where it regulates blood pressure, it does create other proteins, creates essential proteins such as prothrombin and fibrinogen. Why do scientists have to make up very hard names? Okay, so what is fibrogen? Fibrogen is a glycoprotein produced in the liver that plays a very crucial role in blood clot formation. When it's activated by thrombin, which is prothrombin mixed with calcium primarily and phospholipids, turns into thrombin. When activated by thrombin, it is converted into fibrin, which forms a meshwork of blood clots that help stop bleeding. Think of it like a net. It also breaks down old red blood cells, and it repurposes the materials. The primary thing it's repurposing is the salts. However, it does process a lot of other items. I'm not 100% sure, but I'm pretty sure it would repurpose the hemoglobin, which is another protein involved in cellular transportation. But I'm not 100% sure on that. And it works very similar to white blood cells self-destruction. So what that process is simply your white blood cells will surround a virus, bacteria, some other quote-unquote harmful cell, and what they'll do is the stomach of the cell. I can't remember what it's called now. Give me a second. Right. The white blood cell will surround a harmful cell, and it will self-destruct by ripping apart the layers in between the rest of the cell and the lysosome, which is basically like your stomach. It carries a bunch of acids that will pretty much destroy anything in the surrounding vicinity, including the cell that it's in. but that releases a lot of material for repurposing. Okay. Now, I think I went a little bit overboard in terms of diseases that affect the organ, but I'm just going to go through all of them. So, diseases that affect the liver cancer. I mean, now I have this in bold for a specific reason. It's rapid growth of non-useful tissues. And the reason why it's in bold is because most people think it's a rapid death. And although that's not entirely inaccurate, it's actually the other way around. It's a rapid growth of cells that are only useful for a fraction of the time as quote unquote useful cells. Basically, what that means is the cell goes through its lifetime faster than other cells, faster than other of the same cells. Now, treatments for this would include immunotherapy, which is similar to your vaccines that you would take for like the common flu, coronavirus, and a few others. Chemotherapy, which is the more traditional treatment, which is the use of drugs to inhibit cell growth, which, yes, also does include healthy cells. And it's often used in conjunction with radiation therapy. And the reason it is, to my understanding, is because you take the drugs to inhibit the cell growth because it's rapid growth. So what you do is you take the drug, which inhibits the cell growth, but it inhibits the cell growth on a percentage. So what that means is it'll affect it'll affect the cancerous tissues more than it'll affect your healthy tissues. Theoretically, this should put them on almost the same level. And then the radiation therapy typically is gamma radiation, but it's used to destroy the cells. And it's targeted towards the cancerous cells. And, of course, in severe cases, there is surgery to remove the cancerous tissues. Typically, this comes in the form of cysts or abscesses. However, I have heard of cancers that were almost undetectable because they didn't form into cysts or abscesses, which is almost unheard of. Cirrhosis, which is scarring of the liver tissue, unfortunately, there's not a cure. At least, there's really not a cure. You have managing the cause, which generally has to do with preventing the inflammation that causes tearing and eventual scars, which is generally from overworking the liver. So, don't do drugs, kids. Slowing progression. It sounds so hard, and yet it's so elegantly simple. Avoid further damage. Here. It even says it here. Abstain from alcohol. Manage underlying conditions. Follow a healthy diet and take medications as directed. What was it I keep saying? Oh yeah. Don't do drugs, kids. Address further complications. So ascites, which is fluid buildup in the abdomen. Varicoses, enlarged blood vessels that can rupture and bleed. And hepatic encephalopathy. Thank God I'm not going to be a doctor. Which is basically toxins that get so built up in the liver that it eventually gets into the bloodstream, transfers to the brain, and causes brain dysfunction. So, don't do drugs, kid. Treating complications, so that'd be your portal hypertension, which is high blood pressure in the portal vein. This one's a little bit easier in terms of medication. There are vasodilators, which it's just an injection to make it so that the muscles surrounding your veins loosen, therefore expanding the venal capacity. Basically, it makes your veins bigger. Shunting, which is basically it's like when you get a shunt in your heart. It functions almost like a bridge, or almost like a tube that goes inside your veins to keep them open. And in severe cases, liver transplant. Ascites, as mentioned before, is just fluid buildup in the abdomen, which we don't really have a solid this is going to work cure. We don't even have a solid this is going to work medication. So it really works out to dietary modifications, again, like abstain from alcohol, manage underlying conditions, and medications. Now, the medications really depend on the person, the doctor, the time of day, what cycle of the moon. Like, there's from my research, there are so many different medications that, depending on the person, will or will not work. And then, as mentioned before, again, hepatic endotheliopathy. Thank God I'm not going to be a doctor. Medications such as lactulose will work, which I had to look up lactulose because I've never heard of it before. It's a constipation medication of all things. I sat there, I'm like, why the hell would you use a constipation medication for a damaged brain? Makes you pee more. Who knew? Fatty liver disease. Typically, in fact, most often than not, this is due to obesity, which is just as simple as lifestyle modifications. Eating healthy. Have you ever seen? I know what it is in Canada. I have no idea where it is anywhere else in the world. But if you take a look at a plate, half of your plate should be vegetables, sprinkled with fruits. A quarter of it should be your meats. A quarter of it should be your starches. So your potatoes, if you live in Ireland, your pasta, if you live in Italy. Right, those kinds of things. Here's the thing, though. I mean, I don't want to go against the health organization from wherever you are, but it's not entirely accurate. If you were to take your hands, okay, just go with me here. If you were to take your hands and put them together so that your index fingers are almost the full length of each other, and then kind of hook your thumbs around each other, it should form kind of a rectangle shape. That's about how much meat you actually need to eat. At least in terms of actually getting the nutrients. But that's a whole topic entirely. Drop something down in the comments if you really, really, really want to see that. But back to the project. Now, there are so many hepatitis, and I was so tired when I wrote this document. Luckily, I got my good old notes right in front of me. So, hepatitis. Okay, let's start with what is hepatitis generally. Hepatitis is it's inflammation of the liver, but it's inflammation of the liver for different reasons. Okay, and there's a specific reason I did not include F here, but I'm going to just kind of go down my list here. So hepatitis A is a liver virus that spreads differently than any other hepatitis. If I remember correctly, this one is the only one that gets transferred orally. Um, Rest, relaxation, and managing symptoms. Managing symptoms, if I remember correctly, the symptoms of hepatitis A is pain in the abdomen, generally sometimes a fever. Um, just really to manage both of them is, and I stress this, mild pain relievers, because you have to remember up here it removes harmful substances such as drugs. And I did specify prescription drugs. This also includes pain medications. Um, so mild pain medications, lots of rest, lots of fluids, um, and there was another thing. Stay cool, I suppose. Just kind of manage that fever. Hepatitis B, the difference between hepatitis A and hepatitis B is B can be chronic. You can be put on antiviral for hepatitis B. I don't know which antiviral right off the top of my head. But as a general rule, what you do is pretty much the same as hepatitis A. It's just a little bit different. So rest, nutrition, so eat. Like don't eat a lot. Like don't be afraid to eat. But don't eat to the point where you get fatty liver disease kind of thing. Because what you need to do is you can't. I don't really know how it works, but you just need to get stuff into your body so that your body starts focusing on that other stuff rather than focusing about the liver, if that kind of makes sense. And then you need the hydration to move everything that starts to accumulate in the liver out through your kidneys and out through your pee. Is my understanding. Hepatitis C is only passed blood to blood. And the only treatment I could find for it was an oral antiviral called direct acting antiviral for 8 to 12 weeks. I got no idea what it is. I'm not going to argue with a doctor. I've done that before. I'm just not going to go there. Hepatitis D is the only one that's incurable. And the reason it's incurable is because it's hereditary. Now, what hereditary means is it can be passed down from parent to child. Um, manage the only things you can do for it is manage the infection and use of, holy, I can barely read my writing here, pegylated interferon. Huh. Who knew? So apparently pegylated interferon has been the only treatment option for chronic HDV, hepatitis D virus. It has been limited by poor treatment outcomes, side effects, and contraindications. Who knew? World Health Organization knew. Right. Back to the task at hand, though. Hepatitis E is the only hepatitis that's not true. Hepatitis E is one of the only two that goes through the fecal oral route. However, hepatitis E has a higher mortality rate in pregnant women. So, I didn't know that. Didn't know much about hepatitis before I started learning about this project. Who knew? There is no treatment for hepatitis C. Not that I found. And I swear I spent 3 hours looking for something because it's like there's got to be hope. There's got to be hope. Hepatitis F, going back to the Hep F here, it's used as a placeholder name for new hepatitis viruses. I didn't know that was a thing. Little history lesson. In the 1800s, I want to say, hepatitis F was actually used to describe anything that was not hepatitis A, hepatitis B, or hepatitis C. Which was rather interesting for me to learn about. I thought it was an entire class of hepatitis on its own. Hepatitis G is the only one that's non-life threatening. However, there is no recommended treatment for hepatitis G. No specific recommended treatment for hepatitis G. Except for safe sexual practices, since it transfers via bodily fluids. If I'm talking too fast, by the way, do not be afraid to slow down the video, but I've got a lot to go through. Alright, the bicep. Arguably the easiest one out of the 5 to explain. All muscles are technically classified as organs, which I did not know. I honestly thought that the entire muscle system in itself would be considered organs, with tendons and cartilage being separate. But apparently the different parts of your muscular system are organs as well. I just saw them as tissues. Right. So the function of the bicep is first of all, what is it? It's a skeletal muscle used to flex the forearm. Now your bicep is on like the front part of your upper arm. And just do me a favor, take an arm. I don't care if it's your left or your right, but put it out in front of you and have it so that your palm is facing up. Then I want you to take your other hand, whichever one that is, and just kind of put it over kind of the middle part between your elbow and your shoulder. And I just want you to bring your hand close to your face. And you'll feel your bicep, which is the top part where your 4 fingers should be sitting, flex. Maybe it even feels a little bit tighter at the beginning, probably around a 45-degree angle, and then it almost feels as though it goes away entirely. And now I want you to start focusing on your elbow, how it's more tense at the beginning, but as you go, it gets less tense. And that's what the bicep is. The bicep is the front part where your 4 fingers were sitting. The tricep was where your thumb was sitting. And muscles work in pairs, so it's really hard to talk about one muscle without talking about others. The muscles work in pairs. One has to contract while the other one expands. What it works out to. It's used to move the forearm into the body, primarily. It's about the only function. In terms of diseases that can affect the bicep, tendinitis, which, technically speaking, if you ask me, tendinitis should not be something that affects the bicep because the bicep if you ask me. I know I'm wrong. I want that to be clear here. I am wrong. It's just how it looks in my head. The bicep is the actual muscle tissue, and the tendons are separate. However, the whole kind of array is part of the bicep, and that's gonna take some time for me to swallow. So tendonitis, which is inflammation of the tendons. Hold on. I think I'm hearing some feedback here. Tendonitis. Hepatitis. Tendonitis, hepatitis. Just for a little clarification, in case this does come up, because I can't even remember at this point. Us, or hepatitis, I suppose, always refers to inflammation. So, tendonitis is inflammation of the tendon. Suggestions: rest, ice. You gotta try and get it as cold as possible. Compression, and what that's meant to do is it's meant to kind of force the muscle into its relaxed state, so it's not pulling on that tendon, so it allows that tendon to heal. Elevation. Really don't know how that's supposed to work. I can see it because it kind of pulls the muscle. It forces the muscles to follow gravity. But I would think that you would want it closer to kind of allow less space for the tendon, so it's less room to have to heal. If that makes sense. And pain relievers. Like, I've had tendonitis. Like, first of all, I've got bad chronic shoulder issues. Like, I don't know. People tell me I'm full of it when I tell them that every once in a while it feels like someone's taking a small cylindrical object, like a pistol bullet, and jamming it under my shoulder blades for a couple hours. That's usually what it feels like. But every once in a while, it'll feel like someone took a knife and slashed the back across my shoulder blade. It'll be kind of in the middle, right about where a tendon sits. It's annoying, but I've seen people have tendonitis that are like on the ground holding whichever body part the tendon is inflamed and have it swollen to the size of a grapefruit. So I have these three kind of put up together because they are the same thing. I don't even know why they call it different things, because it's the same thing. So myopathy, dermomyosis, and polymyosis is, just do yourself a favor. I'm not going to go into the specifics of it, but basically what it works out to is your, what's the word I'm looking for? Not muscle cramps. It's, pulled muscles. It's basically what it is. However, every description I've seen for it makes it a hell of a lot worse than a pulled muscle. And the pictures I've seen it's like, no, I'm not going to even remotely tell you what the treatment is. I'm going to let a medical professor who's gone to school for 8 or 10 years to get a doctorate tell you what to do. Because I'm not going to screw this up. No. Just no. So I apologize to my teacher if that's not good enough. I'm not going to go into specifics. I'm putting this up on YouTube. I've seen far too many stupid people in my life. I apologize to my viewers. I've seen far too many people think that they're smart enough to know what they're doing. I admit the fact I don't know it all. I'm not gonna screw up on this one. Just trust me on it. I'm not screwing up on this one. The kidney. We're up to the excretory system. Now, a few things to get into before we get into the kidney. First of all, the excretory system is not how you poop. It is how you pee. That is a large misconception for a lot of people, including myself for a large number of years. The excretory system has to do with the front part of your body, not the back part. That's what it boils down to. In addition, the functions of the organ, there are several. Well, it's really only one. But if you add in what it does while it's doing that, there's a couple. So, I had this sentence here, no, it's not a typo, it's not a miss-up, no. This is true. It filters blood out of waste products. It doesn't filter waste products out of blood. And that was really hard. That was hard for me for about 20 seconds. It's like, how the bleeding hell would it filter blood out of waste? And my teacher said, well, if you filtered waste out of blood, then you need kind of like a flap in the back just to take your kidneys out, shake them out over the garbage, and put them back in. Every time I thought about that, and I admit, I apologize to my teacher, I didn't ask, but that's because I figured it out about 3/4 of the way through class. I'm like, well, wouldn't it be the same if you were filtering blood out of waste products? And then I went, wait a second. But the veins are sitting right there. So if the veins are sitting right there, then blood goes in, the waste diffuses out through the filter, and blood just continues on through the bloodstream. It works almost the same way as dialysis does. Why didn't I think about that before? And it works very similar to a coffee filter. Think of your coffee filter. Assuming you've got one of those coffee machines where it actually has a filter and not a pod system like mine does. Come on, Mr. Boom Arm. Thank you. Sorry, I'm starting to have issues with my boom arm being broken. So it's like a coffee filter. It filters. Think of the grinds, the coffee grinds. They stay in the filter, right? That's your blood. The water with the actual coffee that comes out of the coffee pot, that's all your waste product, if you think about it. No, that does not actually apply to coffee. Coffee is not a waste product. Coffee is the nectar of life. So don't go thinking you're eating, or rather drinking coffee grind poop or pee, I suppose, because you're not. The other thing it does is it reabsorbs useful materials back into the blood, such as water, blood plasma, glucose, sodium, and chlorine, also known as table salt, some urea, also known as urine, pee, and in some cases, hydrogen ions or bicarbonate ions. For that last one, it does it because of the pH, the concentrations. Okay. There's something called homeostasis, which is basically the perfect balance of everything. Your body does not like to be out of homeostasis. So the blood, the water, the blood plasma, the glucose, the sodium, the chlorine, the urea, the hydrogen and bicarbonate ions, those are all there. The latter, the hydrogen and bicarbonate, is to make sure your pH stays. I think your blood pH is supposed to stay around 7.3, as I recall. I'm pretty sure I'm wrong. I might be off on one or two points, but it's supposed to sit right around that neutral area. Water has to do with concentrations as well as sodium, chlorine. Well, all of this really has to do with concentrations. I want that to be clear here. Concentrations is how much stuff to how much water is what it boils down to. So it's meant to make sure the concentrations are proper. Otherwise, when you get back to your intestines, nothing goes anywhere except perhaps water. Water goes out your back end. Um, Electrolytes. So this would be the reason for like your salts. This would help fire neurons, which would help with your muscle system so that you can go and grab your cup of coffee in the morning. Also helps with your sugars, just to kind of maintain those sugars and keep as much sugar as possible because sugar is cellular energy. We talked about this in photosynthesis about 6 months or so ago. If you haven't checked out the video, strongly recommend it. The other thing is the thickness, and what I mean by this is blood plasma is primarily water, but hemoglobin and red blood cells, white blood cells, they're cells. They are solid. If there is no water, then they just kind of sit there like a clump of bread dough. And I don't know about you, but I don't like the idea of thinking that my blood is solid and not flowing through my body. That just sounds like... Yeah, that just sounds bad. Now, there are several diseases that affect the organ, and some, if you ask me, the vast majority of them aren't even really diseases. They're more illnesses. Diabetes is probably the only one that could be considered a disease, and only because I want to say it's type 2 diabetes is actually considered a disease. So what diabetes is, and I apologize if you're diabetic because this is going to sound like old news, but what it is it's just too much sugar over the course of your lifetime. Your cells just like, I don't care anymore, I'm going to go do my own thing. So what it does is it prevents glucose, or complex sugars, from entering the cells, which damages blood vessels surrounding the kidneys because there's so much extra stuff. Okay. The kidney's job is to get rid of all the extra and keep only what you need. So if there's an awful lot of sugar that wasn't used in your body before getting to the kidneys, it's got to get rid of all that extra sugar, which can damage the blood vessels because there's so much stuff trying to get out of so little area, if that makes sense. So what will happen is it'll eventually reduce the function of the kidney and eventually produce kidney failure. Ways to treat this / prevent it is insulin injections, dietary changes, don't do drugs, don't do sweets, and regular monitoring. So check your blood level. I would recommend, and I'm not a doctor, I want that to be very clear. I do not have a PhD in how the body works. I would suggest a finger prick about once a month, and just to check your blood levels and blood sugars and all that. And while you're doing that, I promise you, this video is not sponsored. At least I hope not. Go donate blood. You can help save someone's life, especially if you're O negative. O negative? Yeah, O negative. If you're O negative, you can save anybody's life. And just 4 ounces of blood can be the difference between life and death. So while you're going to get your finger pricked to see if you got the proper amount of sugars, why don't you go take a 5-minute drive to your nearest blood donation clinic and donate a little bit of your blood. In Canada, you even get a cookie for it. Right. The things are high blood pressure, which damages the delicate blood vessels um, around the kidneys because the membrane is so thin. And the reason it's so thin is to make it so that there's as much surface area as possible to allow for as much transfer of materials as possible. So the damage will impair the filtering ability. So really the only solution to this is just reduce your blood pressure. And how to do that? Don't do drugs. Don't do sugar. Don't do alcohol. Exercise. Live a healthy life. Go get your finger pricked at a health donation clinic. I absolutely hate saying this word. Glomerulonephrenitis. Titus? Take Bio 20. It's really interesting. Hell, take anatomy. It's also really interesting. You learn a lot. What glomerulonephritis, however the hell you say that, is inflammation of the glomerulus. Oh, looky here, there's that itis again. And what it is it's just a filter in the kidneys. Ways to prevent / help with this is medications, primarily anti-inflammatory drugs, dietary changes. So this would be don't eat a lot. Really, take what you need, not what you want. Dialysis is a treatment for this. Really, what dialysis is supposed to do in this case, it's supposed to take the pressure off of the kidneys and allow the kidneys to heal. That's all it's supposed to do. And in some severe cases, kidney transplant. Polycystic kidney disease. Now, I'm not going to show you guys a picture of this just because I'm pretty sure YouTube is not going to like it. But after this video, go take a look at it. And then make sure, but before you do, make sure you've got a paper bag beside you. Or a garbage can. And probably don't eat. Actually, no, do eat. Because as soon as you take a look at what it looks like, you're not going to be eating supper. So, polycystic kidney disease is basically when your kidneys are covered in cysts. What are cysts? Cysts are fluid-filled sacs. Typically, cysts in this area would be filled with blood, although not strictly the case. And what it does is it causes the kidney tissues to become dysfunctional and eventually tissue death, which is also known as necrosis. So, really the ways to fix this, if you could even call fixing it. Blood pressure management. Make sure your blood pressure is 120/80, I think is what it's supposed to be in adults. Pain control, so this would be your mild painkillers. If you care about your liver, you would want to go on mild painkillers. Don't be like me and take a Motrin Extra Strength, even though it's the only thing that works. And other medications. Usually the only real way to truly fix polycystic kidney disease, besides letting the kidney do its own thing and pray to God you caught it early enough, is kidney transplant. There's really nothing else you can do. Now, the aorta. Now, I'm sure my teacher knows this. going to say it anyway because I didn't know this, and I thought that I was going to lose marks for this because I started doing this, had my mother come in and go, I'm pretty sure that's not an organ. And I looked it up, and apparently the aorta was classified, it was recently classified as an organ, which was actually rather interesting to me. I would have thought that the aorta would have been considered an organ long, long, long ago. Right, so the function of the organ, pretty simple. It carries blood from the heart to the body. Disease that affects the aorta. Aortic aneurysms, which is a bulge in the wall of the aorta. Usually it's because of, I would imagine, usually it's because of high blood pressure, which eventually tears the layers of tissue through the side of the aorta, which creates that bulge due to thinner walls. And it will burst. It will burst. No ifs, no ands, no buts. It will burst. It will lead to internal bleeding. So if it is unruptured, medical and treatment will usually include reducing blood pressure. And if it is ruptured, there will be surgical treatment to repair the tear as well as remove the blood. Basically what they'll do is they'll have you sit on your side, poke a hole in your abdomen, and watch as the blood drains into an IV. So, aortic dissections, which is just a tear in the aorta. So this would be similar to an aortic aneurysm, except not quite as far on. So the tear allows blood flow between the layers of the aortic wall, hindering blood flow to the organs and causing severe pain. So you have the pain because the neurons, the neurons in the area are going, hey, there's damage here. Maybe we should fix that and make this guy sit down and let us fix it. That's why you get the pain. It hinders the blood flow because it's got to get past that obstruction. So think of it like a highway. I think there's a highway in Germany. We're going to use that for example. There's a highway in Germany that does not technically have a speed limit. But let's say for instance that everyone is going whatever speed they want. So there's a bunch of people going a bunch of different speeds on a 6-lane highway, let's call it. And eventually, it all of a sudden goes into a 2-lane highway, but the people in the 4 lanes aren't paying attention. Well, they've got 2 options. They can now start driving in the grass, which basically means they have to stop and merge. Or they can go on and merge anyway, which probably leads to collisions and slowdowns and a whole bunch of other stuff. So that's really what it boils down to. So if it's going to your head, so basically anywhere above your heart, surgery is typically necessary to repair the tear. However, if it's the lower aorta, so anywhere the heart below, medications, pain medications, and probably surgery, depending on the severity and complications present. Aortitis, inflammation of the aorta, can lead to an aortic aneurysm, swelling of the it is swelling of the aorta, and typically treatments are anti-inflammatory drugs. Aortic valve disease, which is a disease that affects the valve between the left ventricle and the aorta. Oh yeah, it even says it there. Valve between the left ventricle and the aorta is not functioning properly. It can be either too tight, which restricts the blood flow, or too loose, which leaks back into the ventricle. Really, really, there's nothing you can do about this except for manage the symptoms, which is don't do a whole hell of a lot of activity. At least not like me, and do it really utterly fast. Reduce your risks, which probably is just simply reduce your blood pressure. And in some cases, well, many cases, surgical repair or replacement of the valve. Typically, this includes basically an electrically powered device. And no, it's not run on batteries. It is literally run by your body. It's got just low enough of a voltage rating that your electrons in your neurons can have it activate. All right, lungs. The function of the lungs really is just to hold stuff. It's the lungs technically are supposed to help you breathe in and breathe out. However, the lungs themselves are not what do that. So they hold the alveoli, which allow for gas exchange. O2 comes in, gets sucked in from the alveoli, goes into the bloodstream. CO2 goes from the bloodstream into the aorta, or alveoli, out through the bronchioles, into the bronchi, from the bronchi, out the mouth, or the nose. It depends whether or not you're like me and are really hoping to be able to pause this so I can put down my microphone and go blow my nose. But we're almost done. Also carbon monoxide. Now I add this in, and it wasn't mentioned. And in a perfect world, it should not have to be mentioned. But it wasn't mentioned in my class, and if you ask me, it really should have been, because it's just one of those little things that I think a lot of people, except those who know about it, forget. That it's hard to explain. It's like, I apologize to my teacher, because I imagine there was a reason that he didn't mention it. And I'm not saying that reason isn't valid. I'm just saying, like, it would have been really good if it just got mentioned even in passing, because it's one of those chemical things that it's like, wait a second, that shouldn't work. And then it's like, that's why it doesn't work. I don't know. I'll explain it in a second. So, it holds the bronchi and the bronchioles. Now, the bronchioles, if we want to think about this like a tree, and that's really what it is. The bronchi is like the big stem, and the bronchioles are like the branches. And they just act as tubes for gases to travel throughout the body. How does the organ do that? Well, it creates the pressure differential inside the lungs. It basically creates a lower pressure environment inside the lungs compared to the outside environment. And how it does that is the muscles between the ribs contract, forcing the rib cage, just because of geometry, out and up, and the diaphragm contracts. The diaphragm contracts downward, though. It's upward, which is something that I was a little surprised on when I was told that, because I would have thought that the diaphragm would have contracted upwards, because I thought it attached basically the other way around. Now, I put this in here because I follow a guy on YouTube, and he just does YouTube shorts, and he's an Australian fellow. And what he does, don't get me wrong, he's not exactly school appropriate. It's not like he says any derogatory stuff. He just swears a lot. I suppose he does censor most of it. But a lot of stuff in Australia has something called neurotoxin. And it affects the mind, hence neuro, and it's a toxin, hence toxin. But a lot of what it does is it makes it so that skeletal muscles no longer work. And I was actually looking at one that was a squid. That's about the size of a quarter. And it is the most toxic animal on the planet, based on his research. And yes, he does do research. He doesn't just say this. So that's why I put that in there. These are technically classified as skeletal muscles. The diaphragm is smooth muscle, which smooth muscle acts involuntary, but the intercostal muscles between the ribs, those are technically voluntary. So if your ribs don't expand, there's no room for your lungs to expand, therefore you don't breathe, therefore you die. And I really wish my teacher could have seen that reaction, because it would have been almost a mirror image of what he did in class. I'm sorry. I'll be quiet now. Right, so there's only a few that I found anyway. I'm sure there's more. I'm sure there's more that we humans aren't even aware of yet. There's asthma, which is just a chronic disease that closes the bronchioles and prevents airflow. Corticosteroids, such as your standard inhaler, which is just a synthetic version of cortisol, which is the natural chemical in the body. And what it does is it reduces the inflammation. If I understand what I read correctly, it works kind of backwards than you would normally think it would. And it would... Cortisol... In the presence of cortisol, everything is relaxed. In the lack of cortisol, everything is constricted. And I would have thought it would have been the other way around. Right. Chronic obstructive pulmonary disease is a chronic lung disease that makes it hard to breathe. It's really a bunch of different diseases clumped in together, but the one that I recognized immediately was emphysema, which is just damage to the alveoli. But hold on, I know you guys can see it, but I'm not even looking at my screen right now. I'll give you about 10 seconds. You guys are only going to need 2, but I'll give you about 10 seconds to figure out what I'm about to say next. Do 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 do. Yeah, that's right. Don't do drugs, kids. Yeah, you see, the damage to the alveoli causes the alveoli to lose its elasticity, and it causes reduced air movement in and out of the alveoli. And guess where it comes from? Typically smoking. Typically. Pneumonia, or pneumonia, is an infection in the lungs due to bacteria, viruses, or fungi. In terms of the bacteria version, it's typically treated with antibiotics, viral supportive care like fluids, rests, and potentially antiviral medications if the cause is a specific virus. And that's key. If the cause is a specific virus. If it was more than one virus involved, they probably couldn't do antiviral, and the reason is they just can't pin it down. It works very similar to selective pressure, where you can kill off some of them, but you can't kill them all, and those that you don't kill off are resistant to the one you just did. So at the end of the day, it just really won't work. The other thing is fungal. Fungal pneumonia may require antifungal medication. Severe cases may require hospitalization for oxygen therapy and IV fluids, because they just can't
antifungal medications you can only have in a specific dose. Whereas IV, they can go, okay, we're going to open the valve to this amount and have it all done. Liver cancer. Not liver cancer. Lung cancer is exactly the same as liver cancer, except it's with your lungs. And it works. It's pretty much, it is the same thing, really. It is the same thing. Immunotherapy is a little less used for lung cancer, but it is a consideration. So again, it's the rapid growth of non-useful tissues. Treatments are immunotherapy, similar in style to modern-day vaccines to viruses. Chemotherapy, which is the use of drugs to inhibit cell growth, often used in conjunction with radiation therapy. And surgery, which is invasive surgery to remove the cancerous tissues. In most cases, it involves taking out an entire lung. Well, that was a lot of talking, and between my lungs and my nose going, screw you, I want to rest now. I think that's going to be it for today. Thank you all for watching and listening. Hope you have a good day, good week, good month, good year. And I'll see you next time. I am thinking I'm going to have a channel update video up soon, I hope, when I can stop being busy and actually get onto my recorder for something other than a school project and actually be able to do it. But it's the same old. I still have between 10 and 12 months of content that need to be edited. Not enough time to do it, and not enough data. And my grandfather's home, which means I have more restrictions on my data. And it also means that I can't upload to YouTube for a while. So, yeah, we'll see how we're going to fix that. Anyway, hope you have a good day, and good luck. One last thing before I go, now that I think about it, is I need to connect these, specifically how things can go wrong, to the effects that what can go wrong has on the system as a whole instead of just the organ. So, liver cancer, as well as cirrhosis, pretty much affect the digestive system in the same way by making it so that the liver cells don't produce enough bile or don't produce bile at all, which makes it more difficult for fat to be broken down, which in turn affects the digestive system. Fatty liver disease really is just a buildup of fat in the liver, which of course those cells aren't doing anything except storing stuff, which pretty much works out to the same thing. And hepatitis A to G affects the digestive system by introducing a toxin in the form of bacteria, fungi, or viruses that typically affect the digestive system by themselves, as well as typically swelling the liver, thus making it more difficult for the liver to do its job, which makes it difficult to break down fat, which affects the digestive system. And I think that's it. In terms of the bicep, tendinitis, the swelling of the tendons make it very difficult for the muscles to actually do their job properly, because it's the tendons that pull the bones back toward you and forward, which can create stiffness, really. Myopathy, the way
those three affect the system as a whole. From what I can tell, is in short, make it so your muscles don't work at all. I'm not going to go too in depth about it because, as I mentioned before, I'm not a doctor, and based on every description I've seen of these things, I'm not going to even remotely chance getting it wrong. In terms of the kidneys, diabetes, make it so. Really, what it does is it makes it so that you can't filter. You can't produce urine. Is what it boils down to. The vast majority of these basically mean that you can't produce urine, which means you cannot actually excrete waste product from your body. So those wastes and those toxins inside that urine build up, and especially if you can create urine but can't actually get it out of your body, it can eventually rupture the bladder, which is a lot of bad stuff. The aorta, really the biggest thing here is that it reduces the supply. Primarily, the most important one is of oxygen. It reduces the supply of oxygen to cells, although at the end of the day, any one of these actually creates lower supply of all products that are required for cellular respiration, as covered in a previous video, as well as other things as well, internal bleeding. Most of all of these really just kind of restrict your air intake and air outtake, which reduces your your blood O2 levels, which reduces the cellular respiration that can occur, which eventually, assuming it gets bad enough, creates muscle death or tissue death, and a dead person. And typically that can, especially with your brain, since your brain uses a lot of oxygen really quickly, if your brain doesn't work, your ticker doesn't work. If your ticker doesn't work, you die. That's why you can survive, I think it's 6 minutes maximum without air. Okay, now I know I've got everything. So yeah, y'all have a good day, good week, good month, good year, and good luck.